everybody, and thank you so much for being part of our webinar today. We know that you have very busy schedules, so we appreciate you taking some time out to spend with us. Hopefully my screen is now sharing, and you should all be able to see that we are going to crack on with our conversation about the science behind healthcare audience engagement. So before we get started, it's good just to set a little bit of context as to why this is important. And the truth is, it's important because the fight for attention has never been tougher. And you can see here that actually pharma spend is forecasted to reach 68 billion in 2024, which for the very first time has meant that it's overtaken the tech industry to become the second biggest spender of any vertical in the media space. And we also know that despite all of this massive investment, that studies suggest that between 23 and 50% of that marketing spend, it doesn't actually perform as well as it should. And as a result of that, well, we have a very, very busy and very noisy landscape with that kind of level of spend being focused on on the audience that we're trying to speak to. Our jobs as marketers has really become more difficult and continues to become more difficult. So if that's the challenge we face, we really need to do so by deepening our understanding of the human mind. So the big question is, why are we strangers to ourselves? And the truth is that a study concluded that we believe about ourselves that we are econs. And to describe econs, we believe ourselves to be rational thinkers who make data-driven choices as we go through our day. But in truth, we are not the economical rational thinkers that we think we are. And in fact, in truth, we are much more driven by logic, by emotion rather, and up to 95% of our decisions are unconscious. Now, the late and great David Ogilvy summed this up really well, I think, by saying people don't think what they feel, they don't say what they think, and they don't do what they say, which is, he was long before this study that identified econs in 2003, but he definitely summed it up beautifully in terms of the challenge that we face. So if we're not econs, if we're not driven purely by logic, what is it that drives choice? Well, before we get started on that, we're going to have a bit of a conversation about how the human mind works, which gives us some great clues into decision making and how we make those choices. So the first thing I wanted to share is that brain signals travel around our head at 268 miles an hour. So if you're thinking about a number of things and you feel like you've got a busy head, that probably explains it. Secondly, we're processing over 11 million pieces of information every second, which is absolutely staggering. We also process images 60,000 times faster than we process words, which we all know because that's why we use nice visual creative in order to engage our audience and try and create more interaction and more interesting formats to grab attention. And finally, our brain uses 20% of our energy, which obviously is a great advantage for us to have a big and useful brain. But the downside of it is that it's not very economical in terms of the energy that it consumes. Now, the way that our brains have evolved is that our first piece of technology, our mammalian brain, is 300 million years old. And it really developed in order to ensure our survival. So it helps us to ensure that we have enough resources, it helps us to ensure that we procreate, and it helps us to ensure that we're safe. But around 3 million years ago, we developed our new neocortex, not so new anymore, but of course that's the part of our brain that allowed us to have higher brain function, which allows us to, has allowed us to evolve into the creatures that we are today. Now, when we think about our brain, we can think about it as Daniel Kahneman did, as a two-system brain, and that we think in two different ways. And system one thinking is really the part of our brain that works on intuition. It actually helps us to make lots of unconscious decisions. Like, for example, we don't decide not to put our hand on a boiling pot. We just know that, and our subconscious or our unconscious mind helps us to make decisions not to make mistakes of that kind. So it's the kind of stuff that manages reflexes, innate skills, and all those other interesting parts of our working mind. And the second part is system two, And that's the part that allows us to concentrate, construct our thoughts, and to analyze things. And it's obviously an incredibly useful tool, but it's also very expensive. It uses a lot of energy. So when we sit at our desk all day, for example, thinking about an interesting challenge, even though we may have barely stood up, we feel exhausted at the end of the day. And the reason for that is because we've been in system 2 thinking for much of that day, using a great deal of energy. Now, because system 2 thinking is so expensive, our brain has cleverly developed lots of things called heuristics and biases, which allow us to make choices in a slightly different way, but it can lead to some irrational behaviour. And we've provided a sort of little bit of a simple analogy for this, where, as an example, we might go into our pharmacist with a headache, and it might be that ever since we were a child, in the cupboards there's been a packet of branded painkillers which we've always used. And so we walk up to the counter, we buy them, and we go and pay for them. But actually, the generic option was next to it, a fraction of the price. But we're actually not thinking with System 2. We're not necessarily making a data-driven decision. We're actually just making an unconscious decision based on behaviour that we've always exhibited. And therefore, it can lead to ill-considered or irrational decisions. Now, the interesting thing about this, as we think about healthcare marketing, is that even between the stethoscope, we're still operating with the same mind. So healthcare professionals and patients are absolutely no exception to this thought process. Now, I mentioned some of those heuristics and biases a few moments ago, and we're going to talk through a number of them now. Now, there are many hundreds that have been developed over time to help us to understand what these shortcuts look like, but I'm actually only just going to share 3 of them with you, which you'll be relieved to know. And the first one of those, which we'll definitely all be familiar with, is our confirmation bias. Now, the way that I try and think about this from a patient perspective is that, as an example, if one wakes up in the morning experiencing some symptoms, we might make a decision and think, I think I might have X condition. And that can vary from something very minor to, if you're more of an anxious person, something very major. And what we do is we then go and take it to our laptop or our phone, and we start searching for confirmation that that is in fact what we think we've got is what we've got. So what we haven't done is gone and made a conscious choice to go and examine the symptoms that we have and look for a likely cause. We're actually looking to confirm the thing that we believed in the first place. And I'm sure you've all got many examples yourself of where that can be true. Now, the second one is the anchoring bias, and this is where we establish a behaviour early on, perhaps in our career as a healthcare professional, and then we continue to exhibit that behaviour because we're anchored to that bias. So we know, and our brain knows, that in this situation I do X, Y, and Z, and healthcare professionals are no exception. So, and this might explain when we come out with a fantastic new treatment, which based on all of the data shows that it's a great treatment pathway for patients, we don't immediately see 100% uptake the following day or within the next treatment options. It's because people are anchored to their original beliefs. And so we have to think about ways to disrupt that anchoring in order to get them to change the way that they behave. And the third one is the availability and recency heuristic. And the way I always think about this is thinking about the reason that we have a field force and why they have a number of occasions that they want to connect with a healthcare professional, a set of target healthcare professionals on a certain frequency. And the reason is because we know that if we have our information front of mind, in other words, it's available and it's recent, then they're more likely to remember it and they're more likely to apply what we've told them in their next decision around the treatment option that they provide. Now, the next thing that I want to talk to you about and share with you is around loss aversion and the framing effect. And the truth is, we are more likely to take risks in order to avoid loss than we are likely to take risks in order to create a gain. Now, this might be linked to our mammalian need states, which I'll come on to a bit later, around survival. So in other words, we would take a bigger risk to keep our resources than we necessarily would be to gain our resources. Now, this is a study which was conducted to really help show how this framing effect worked. And what they did was they had 2 different cohorts of the same number of people, and they gave them a scenario. And that scenario, which was a long time before COVID, was that a strange virus was going to come from another continent, and that virus was going to affect a number of people, and that each of these individuals they were talking to had a couple of options that they could employ as a treatment option. And so with the first set of people, they gave them two options. They said, if you choose option 1 as your treatment pathway, 200 people will be saved, guaranteed. If you give them option 2, then there's a 1 in 3 chance that 600 people will be saved, but there's a 2 in 3 chance that no people will be saved, which is obviously focused very much on the potential gain. Then they asked the second set of people, and they said, okay, if you choose option 1, 400 people will die. But if you choose option 2, there's a third chance that nobody will die and a 2/3 chance that 600 people will die. Now, as you all obviously understand, this are exactly the same odds in both instances. But the way they framed it had a dramatic impact on the way that people responded to the question. In option A, 28% of people went for option 2. In other words, they didn't want to take the risk in the majority to make that gain. But in option 2, 78% went for option 2. So in other words, when it was presented as a potential loss, people were much more likely to try and mitigate that loss, which is really interesting when we think about, as marketers, how this framing effect can have a very different outcome on the way that people choose to behave. Now, hopefully what that's done is to establish a little bit about how our brain works. It's established a little bit about how we are all subject to heuristics and biases, and that the way that we position things and the way that we frame things has an impact on the way that people behave. And so we have opportunities by understanding human behaviour in order to change it. Now, what we're going to talk through next is how we can help to make the change that we're all striving for. And here is the process of how we might think about that. So the first thing that we're going to do is we're going to develop a brief. And that brief is clearly going to have a business objective at its heart. And we're then going to examine what is the business problem that we have to solve in order to meet that objective. And finally, of course, who is it that we're trying to talk to? And once we've established a brief, we can go into our second stage, which is the step back. And we want to take a big step back, really interrogate that brief and do a lot more detailed research, thinking expansively about the task that we've set ourselves. And when we think about that research, what we're trying to do is examine and consider what people currently believe, how they currently behave, and the reasons that they currently behave in that way. And that's where thinking expansively about it comes in really handy. The second, once we've done that and we've really built an understanding of why we think people are behaving the way that they are and the emotional context behind that, we can think about potential solutions to the behavioural problem that we face. And having thought about a series of potential solutions that might change that behaviour, we can form a hypothesis and think about, okay, well, we believe that right now people believe or act like A, and they do it because of this reason. We want them to do this for, in a slightly different way. And so our hypothesis is, if we do this, then they're going to do that. And it gives us something to test against. We then look at the roadmap, and that means that having formed our hypothesis, we can really flesh out a full experience against our proposed solution to take people along the journey with us towards the change that we're striving for. And once we've done that and we've mapped out the experience, we need to outline a detailed testing strategy to show what it is, so that we can understand exactly how successful that's been, and obviously then use that data to adapt our approach and change it as we move forward. But once we've developed that testing strategy and we know what the proposed solution is, we can write a creative brief that allows for the ideation and building of that experience so that we can take it forward into production. Now, here, what we've done here is to really provide a real-world application of some of this thinking. And in this instance, what we were trying to do is to, working with a very large and well-known pharmaceutical company, build trust between themselves and healthcare professionals by adding value to patient interactions. And the reason that we felt that we would be in a position to do this is because healthcare professionals are time poor, but people in this case with atopic dermatitis have complex needs. And what we showed was that there was a friction between those two things. So in other words, the healthcare professionals didn't have the time to meet all of the needs that those patients suffering with atopic dermatitis had. So what we needed to do is say, okay, well, if that's what the brief is, that's what we need to achieve, let's take a step back. And that step back in this instance is really look at where do patients need the most support. So in order to do that, we need to examine the current behaviour, as I mentioned earlier, and really think about what our audience is doing and what instinctual and emotional content is driving that behaviour. Then we can look at the desired behaviour and consider, okay, well, we know what people are doing now and we have some understanding of why they're doing it and what the emotional context is, but what do we want them to do instead? And once we've decided what we want them to do instead, we can start to consider what the emotional drivers would be to change their behaviour to that we desire. So let's look at some of the stepping back that we did in this instance. So what we've done here is we've framed this around reasonably straightforward data sources, which you are no doubt probably already looking at, because it helps to show how the insight we already have can be framed in this way to be useful. Now, which is represented here is some keyword research. So what we did was we looked in the UK at all of the things that we believe that people living with atopic dermatitis might have in terms of information needs. And we took a huge set of keywords and then we categorized it in such a way that it would help us to understand some pillars of need states. Now, the first one of those was alternative therapies. So we saw that there was a lot of search for people looking for what else can I do other than maybe the pharmaceutical option that they were doing. The second one was diet. How should I change my diet in order to make sure that I'm giving myself the best chance? And third was mental health, which was, really the mental health impact that living with atopic dermatitis has on the patients over a long period of time. And we cross-referenced this against some other research which we performed amongst dermatologists, which showed that dermatologists really do understand the impact that the condition has on mental health, and that they are interested in the creation of holistic strategies which would help to not only tackle the condition but also tackle the stresses and anxieties that come alongside it. So this was one of the areas that we focused on, which I'm going to unpack a little bit for you in terms of what we did next. Now, not being satisfied with one data set or even two data sets against the keyword research and the research we did with dermatologists, we wanted to take a further look around, and we used this IQVIA data here, which showed that at least 83% of people said they were at least a little embarrassed by their skin when living with atopic dermatitis, and 86% said that using a product helped reduce embarrassment. So we know we've managed to cross-reference and show that not only the keyword research and what we heard from dermatologists, but also other data points help us to understand that this is a need state that exists within the audience. And the next thing that we want to think about is, okay, we've got this research now, we can start to understand how we can apply that research in order to meet the needs of particular audiences. Now, often audiences can be divided up and described by personas within a persona targeting model. And these are obviously useful, and they provide an understanding of attributes, potential channels that we might find that audience in, and a range of other things that can be helpful in us envisioning who we're trying to talk to. But when we've dug in and really understood different cohorts of people based on their emotional need states, it can be much more helpful to think about them as psychographic segments. So in other words, rather than a set of personas, we end up with a set of emotional need states which represent different segments that we want to address. So if we understand those emotional needs, we can meet those people where they are and respond to them in a way which is going to meet those needs and drive them forward towards the change that we're seeking to drive. So at the end of our research phase, there's some key things to remember. Firstly, empathy is key as a researcher. And what we mean by that is when we're looking at insight, it's really important to understand the why behind what we're seeing in the data. So we might see lots of reasons that people behave in a certain way, or the data might tell us that people behave in a certain way, but why is that? And what else can we uncover which will help us to really dig into the emotional state which is evident from that behavior? The second is that channel is context. So when we're looking at data sets like, for example, social listening, or maybe we're looking at data where we're having one-on-one interactions with people in order to understand a little bit more about them and some of the things that we might be able to do to support them. They're two very different data sets, because what somebody might be willing to share on a social media channel and the way that they might describe things is very different to what they might say to you in a one-to-one conversation. So we have to apply some thinking to the context that might apply within the channel where we've been collecting our data and insight. And that's why it's important that we really synthesize data sources to understand context, which is why I showed a number of data sources there to show that we wanted to make sure that a number of things added up to the same conclusion in terms of the need state that we were looking to address. And finally, once we've done that, once we've understood some of the emotional needs and drivers through our research, let's segment those into different psychographic segments in order that we can address their needs through a messaging matrix or through an experience in a way which really makes sense. So now we've done that, we've done our research base, so now we want to take the leap forwards and use key insights to really design a messaging matrix which we believe is going to drive the behaviour change that we're seeking. And finally, after we've done that, in this instance, what we wanted to do was create resources that drives that behaviour change, and those patient resources were to be delivered directly to healthcare professionals who would be able to provide them to patients within a particular appointment in order to meet needs that they perhaps didn't have time to meet. And we also wanted to make sure that we provided a series of assets to a team who would then amplify those to all of the local markets, who would localise them and drive them forward in their particular market. And that's where it got a little bit interesting in terms of some of the stepping back. Now, the next thing we're going to talk about, I mentioned earlier, are mammalian brains and what it is that they're there to do. And we talked about resources, social or safety and social connection, and also sense of self or psychological well-being, and ultimately procreation, which is a part of that particular area. Now, so what we did in the case of this particular piece of work was we looked at the mammalian framework and we thought about some of the insight that we had found in order to provide some instinctual context. Now, what you can see here, there are some snippets taken out of social listening data, and each of those snippets represent a much larger data set that said things which were similar to this, to give us an idea that there was a cohort of people who were in the same emotional mindset. So under resources, you can see that this person said, I used to have a pretty good job when my eczema was mild. Now I face the possibility of homelessness because I'm unable to work. So what we see here is that this person is suffering from a genuine concern about resources. The next one you can see here is, in the depths of my flare-up, I couldn't comprehend what I was seeing. I isolated myself. And so this person is experiencing a lack of social connection, which we know is one of our main mammalian need states. And finally, under the sense of self, this person says, whatever I do, the eczema in my body is getting worse. It makes me feel uncomfortable to a level that my depression is hitting an all-time low. And so what we see here is that this person's sense of psychological well-being is being severely affected, and that they're exhibiting a loss of agency and powerlessness. But having gathered some of that instinctual context, we then want to apply some emotional context. And in the first instance, we can look at that and say, if they have a genuine concern about resources, really what they're experiencing is fear. And in the second one, where people are experiencing a lack of social connection, or that need state isn't being met, they're lonely, they're suffering from loneliness. And finally, the loss of agency and powerlessness can be described really as a person who's in a state of desperation. So what we're going to do now is have a look and see how we can then apply some simple messaging to help meet that person at the point where they are. In other words, how is it that we talk to that psychographic segment in a way which is going to resonate? So I'm going to use the example of the loss of agency and powerlessness, or emotional context of desperation, and examine what is the future behaviour that we want to drive. Well, what we want to do is we want those people to seek professional support and lean into their community, their friends and their family, in order to find the love and support that they need to help them with some of the challenges that they're facing from a mental health perspective. And so when we get to the messaging, we can talk directly to that person as we understand their emotional state. So we can say, if you're still having a hard time coping with negative feelings like anxiety and depression, it's important to seek help from a mental health specialist. In addition to counselling, talking to someone you trust, such as a loved one, a friend, or someone in your community can really help. So in other words, we've really tried to understand and then meet that person where they are and provide them with messaging which is going to help them to drive the behaviour of seeking support. What was interesting is we were looking at this data through the lens of some of the UK research that we'd done, and so we wanted, as we were going out to emerging markets where these assets were going to be localised, we wanted to understand if the need states remained the same. So the first thing we did was we looked at the keyword research across each of those markets, and what we found was that the alternative therapies, the diet, and the mental health all came out as the three largest pillars of need state represented in that data. So what we could have done at that point is conclude that, well, actually there's parity with the UK, so the need states are the same. However, what we found through reviewing social sciences papers is actually there is a very different perspective on mental health in some of the emerging markets that we were working with. So what we found was there was greatly more stigma around mental health in some of those markets than they were in the UK, as an example. And so what we needed to do was to include that nuance in the way that we communicated with people, understand what their emotional states were, and talk to them in a slightly different way. So as an example, going back to lack of social connection or loneliness, we asked people to seek professional support when fearing stigma within their social network, because that's what we wanted them to do, because we knew that was a more likely need state. So we were able to change the way we talk to them to say it can sometimes be hard for friends and family to understand what you're going through. In other words, we wanted to acknowledge the stigma that they may be experiencing around mental health, and then encourage them, instead of speaking to their friends and family, but actually signposted them much more heavily towards healthcare specialists in order to meet that need. So hopefully that shows how you can take another step back, layer on some more data, be an empathetic researcher, and then come up with a slightly different solution. Now, the last thing to say is that testing is essential, because after all, what we're talking about here is behavioural science. So we want to make sure that we're testing things. And the way to approach that really is to define the attitudinal and behavioural outcome. In other words, change in what we want your audience to think, do, and feel. So what is that? Before we get started, what is it that we think the outcome and the behaviour changes that we're seeking? And then we have to go through the process of really identifying the best way to measure that outcome, because we're not necessarily going to measure that with, user sessions on a website or downloads of a particular piece of resource. We need to find a more complex way really to understand how it is that we're going to measure that behaviour. So once we've got those parameters set, we can think about what it is that we want to test, because we'll want to constantly test. And there are a whole variety of things as we execute on the experience that we're going to roll out that we can test. So we could be testing the messaging to see whether that's really resonating with people. We could be looking at design elements and applying things like colour theory, or we could be looking at something like user experience. So, but what we need to do is we need to make sure that we have a testing plan that tests those things individually. Because of course, otherwise, if we were to change everything on a page all at once, we wouldn't really know what it was that had made the impact and wouldn't be able to take that forward in our learnings. And the final thing is, it's really important to set a time frame and a data threshold. So when we begin our experiment of rolling out our messaging that we think, or our experience that's really going to drive change, how long are we going to leave it before we examine that data? Or how much data are we going to collect before we pause, take a look through it, optimize, and go again? So in conclusion, what we've covered is some of the heuristics and biases that we should all be considering. We know that our audiences are subject to them, so how can we consider that in the way that we think about approaching some of the objectives and the business problems that we have before us, and the ways in which we want to drive behaviour? We can use things like mammalian needs to really understand context and understand why people might be behaving how they are when we apply the insights to that framework. Next, we need to make sure that we contextualize all of the data sources that we have in order to make sure that we get truly to something which is an accurate reflection that allows us to build rigorous psychographic segments. And finally, we need to make sure that we have a rigorous testing strategy that helps us to really draw the most out of this approach. So I hope that was helpful and useful, and it provided you with an opportunity for some system 2 thinking maybe. And I'm going to pause now and just go and see whether we have any questions. Okay, so one of the questions that we commonly get, actually, and I've seen raised there, is around when we talk about some of the testing elements that we have you got any examples of that? Well, one of the things that we've done recently, actually, which was very interesting, was to try and think a little bit about some color theory for a client. And this was a slightly different kind of situation because they were ultimately, in the end, trying to sell a product. And what they were doing was looking at some of their data and thinking about how it is that they could use colors and test how well different colors worked in terms of ad formats and things like that in order to drive greater sales of their particular product. Now, in that instance, what they wanted to do was to have a look at the colors that they sold most of. So in this instance, it was actually the blue and black product was the one that sold the most. So their theory was, well, what we should do is change our creative to represent our blue and black products, and then off the back of that, we're more likely to make more sales because that's what people buy the most. But we wanted to take a step back and look at that in a slightly different way and apply some different thought processes around how we approached that. And what we knew was that different colors represent different things. So, for example, pastel colors, things like, pinks, etc., they actually represent a feeling of warmth, and so they can be quite attractive. We also know that red can equal action for obvious reasons. We all associate red with lots of things, but it definitely makes us stop and think about doing something. And so what we did was we rolled out a series of color tests to try and understand how people would respond to them. And what was really interesting was actually the pink creative that we tested actually drove much better response than the blue and the black. But what was interesting was it didn't sell more of the pink product. It just drove more people into the site so that they could take a look and understand what was there, and then they still bought the blue and black anyway. But the point is that within the creative that we produced, we learned something very important, which is that people respond differently to this color than they do to other colors, and ultimately it leads to a better outcome for them as a business. So that was really very interesting. So we've got another couple of questions here. So we've got, do you have examples of its application to healthcare professionals? Which is a great question. And actually, it's funny you should say that, because I did actually keep a little something up my sleeve just in case somebody asked me that. And in the interest of time, I didn't know if I'd be able to get there or not. But actually, I can get there because we do have a little bit more time. So I'll share an example, which is engaging surgeons in a peer-to-peer community. Now, what I've done here is shared a bit of a framework that can be used in order to really start thinking through the problem that you have and how you might be able to address that problem with with any audience. But in this case, I'm going to show you how we applied it to a healthcare audience or a healthcare professional audience. And so it shows you all the things that you'd expect up at the top. We need a business objective. From that, we're going to gain a marketing objective. And then from there, we're going to state a marketing challenge. And then, of course, you see the stuff down there around the persona, so the target audience, who are they, and what are the jobs that need to be done in order to meet the pain points and help those people to achieve their goals. And then down below, we start to see some of this stuff around current behavior. So we can use this to dig into our insight, think about the insight that will motivate change. But first of all, we're going to say, what does the insight tell us about what they're currently doing? Then we can look at a future behavior. What do we want them to do, or in some instances buy? And then we can take a look at some of the current reasons that they might be behaving the way that they are, thoughts and feelings, pain points, and then think about the future reasons that they might do something different. So hopefully it just helps to put a little bit of context around how you might plan this kind of thing. And then what I'm going to do is apply this case study to it, which was, we were asked to work with a leading medical devices company in order to drive an acquisition for a peer-to-peer learning and development platform for surgeons. A very interesting and impressive platform, and it had some very interesting, or has some very interesting features. So what it does in effect is you can take your surgical instruments and you can perform surgery, and the surgical instruments is recording exactly what you're doing. So you're getting a very, very detailed view of what the surgeon is doing. And what this platform did was it allowed you to upload that information onto the platform, and then it allowed your peers within the community to comment on it. So and the purpose of that might be to learn. So you might say, look, this is how I did this operation. What do you think? How would you do it differently? Or you could be saying, I'm a real thought leader, so here's how you do this. This is a novel way of approaching this particular procedure. So really fascinating. And what we wanted to do, the standard approach to this, to engage with these healthcare professionals or surgeons, was to promote the technical features to the audience. So they really wanted to push, well, look, this is what this platform can really do and what it's capable of. But we wanted to think about it in a slightly different way through a hearts and minds approach and understand a deeper layer of audience understanding. And there were two things that came out from our research which we were able to identify. One is that surgeons are people often with quite a big ego. Now, that's not supposed to sound like a criticism. It was a reflection through the insight that surgeons are often people who want to be the best, and that they're very, very driven. And we've described that as ego, but you could no doubt describe it other ways too. And the second part is that, as with most healthcare professionals, there's also a big sense of altruism. They're in it to save people's lives and to make a difference. So we then turned back to our grid here, and we had to think through how we might approach it. So we knew our business objective was to grow market penetration and increase revenue. We knew that our marketing objective was to increase new acquisitions. And we knew that our marketing challenge was that surgeons were not aware that the tool exists, and they didn't understand or don't understand the impact that it could have on their practice. So that was a marketing challenge. And we had a look at our audience. So we wanted to talk to senior surgeons in large hospitals who struggle with having expertise and time available to give and receive feedback and learning on their work. And the jobs to be done were really that surgeons are committed to being the best for their patients, but they have very low opportunity for learning and gaining peer advice on refining techniques. So we needed to open their eyes to this offer. That was the job that we needed to do. Their current behaviour was that they were working in fairly isolated ways, and there wasn't the opportunity for regular input on their skills, so they weren't getting it. And the reason for that was that schedules and ways of working meant there wasn't that opportunity. Also, surgeons who believe they are or must be the best are also less likely to seek out input on their procedures and ask for mentorship. So the future reason that we thought people would engage with this platform is they weren't necessarily getting their own, wanting to get mentorship for themselves, is that they felt that they were giving back to the feedback. They were able to provide feedback to others, and also that they would benefit from a sense of community. So very simply, what we did was look at two different ways, or two very simple messages that we could use in order to share expertise with younger surgeons. To really talk to those two different need states. So from an ego perspective, we came up with the best way to share your expertise with younger surgeons. So you're speaking to someone saying you have a real opportunity to add value to your colleagues. And really, from an altruism perspective, we looked at messaging which focused around the tool your patients wish you were using, so that we knew that we were speaking to people in a way that was going to allow them to understand that they were likely to drive better outcomes, which was their ultimate desire. So I hope that helped to answer your question. So we also had a question around practically how do you approach testing? Well, testing needs to be approached in a whole multitude of ways, depending on what it is that you're trying to achieve ultimately. So it is a bit of a it depends on the scenario type question. But to give some examples, and I did provide an example, for example, of testing only ad formats. But there's also ways of doing multi-messaging testing where we can really go out and see how well messaging resonates. The one other thing that we have to think about from a testing point of view is, what is it within our experience, or what data can we collect that really helps us to understand whether we're changing behaviour? Now, in some instances, to give a few examples of things we've worked on currently, we might be trying to get people to refer to a clinic and then have a particular conversation with a healthcare professional. And because we're able to create an ecosystem which kind of encompasses the full journey, we're able to see it at least to the point where they have made an inquiry. And then, but where it often gets tricky is where we have to work with partners for them to then provide us feedback on whether, not individuals of course, that would be wrong, but provide feedback on the outcome of that particular situation. So it is complicated and it's hard to answer that question without looking at a particular use case. But testing can be conducted across all different areas of your digital ecosystem. The tricky bit is when we try and measure behavior offline, and that requires a different approach depending on what the scenario is. But one example, as I said, is using partnering with the people that you're driving people towards to see how they behaved when they got there. So hopefully that provided some value. If you have a particular use case in mind where you would like to talk about that in more depth, please do let me know, and we can try and work out a way that testing might be applicable in a particular scenario that you've got. So I think that's answered all of the questions that we had from the audience. So that just really leaves me to say a huge thank you to everybody for attending the webinar. Very excited to have you here, and I hope that you enjoyed it. And of course, if you have any questions for us, or if there's anything else that we can share in order to be helpful in illuminating this topic, then we'd be all ears and very happy to do so. And with that, I will wish you all a wonderful day. Thank you so much.